In any system, there are challenges. Let's look at these challenges that are affecting digital health systems in Africa. So we have data gap and data quality issues. This has been the challenge across all uh, facilities because the tools are there, but you, the user, have to make sure that we have the quality of the tools to use. We have health workforce shortage of skill gaps in the health sector. We have infrastructure constraints. These include power, connectivity, devices. And in most of our implementations across the country, we have faced a series of challenge with power, wherein we have to deploy extra power source like power banks to power systems, and then also connectivity and devices. We've seen where devices has been stolen and at the end of the day broken, maybe through accident and other thing. We have fragmented systems across in different places where everybody want to come and implement their own system. At the end of the day, you will find out that only few will survive, and then we have policy and also regulatory gaps across health system. So in all of these challenges, uh, they limit the effectiveness of the public health systems. Uh, these challenges are structural. Digital health does not remove these constraints automatically, but they provide tools that can mitigate their impact and then also when implemented appropriately and using sustainability in the implementation. Next slide, please. Let's look at the role of digital transformation in addressing system weakness. So we have timely and accurate data for decision making uh, and improve coordination across health systems level, better visibility of health commodities and service evidence-based planning, and resource allocation, system accountability. So we've seen this over the time here where we have when we have the implementation of maybe the M supply, the Open LMIS. These are tools that have visibility across all level. You now be here, for example, in Freetown and see the stock status of a health facility, maybe 100 or 200 miles away from the central. And then we have all of this. We have now data that can be used for quantifications because the transformation of the digital health has addressed this systematic weakness. The key point is digital health strengthens systems only when embedded within broader reforms. So in all of this, digital transformation is not just the digitalization of paper processes. This involves rethinking how system work, how data flows, and then how decisions are made. In Africa, successful digital transformations align technology and then governance, workflow, and financing reforms. This has greatly helped the implementations around digital health. Next, please. So let's look at the essential enablers in governance and policy. We have clear national digital health strategies, strong governance, leadership, and ownership of these tools, define roles and responsibility, data protection and privacy framework, alignment with the health sector priorities. So in this a key enabler in governance and policy when it comes to digital health in public health. And one clear thing is to have a clear national digital health strategies. And thankfully, Sierra Leone will develop that. We now have a strategy that guides in all of what we are doing. And we also see where we have strong government leadership and ownership. For example, we have the M supply, which is being owned by the National Medical Supply Agency and the Directorate of Pharmaceutical Services. They have ownership of this tool, and then there are locals now who can solve some of this problem. And then we look at, we say governance is the most critical enabler. Without strong leadership and policy direction, digital health systems become fragmented and donor-driven. Countries like Sierra Leone have made progress by aligning digital health initiatives with national health strategies that we've seen over the national supply chain strategies over the time that we have embedded all of these strategies to make sure that we have ownership at the end of the day. Next slide, please. Let's look at essential enabler also for standard and interoperability. This is key, and then we have key requirement to have data standard, common data standard, interoperability system. We have systems that should speak to each other, and avoidance of parallel reporting system, which I've already talked about, use of national architectures, and then in all of this, if we have all this requirement put together, we'll be able to have a connected, efficient, and sustainable digital health ecosystem. Interoperability is defining features of a mature digital health system. When system cannot communicate, data remains underutilized, and interoperability ensures that digital health investment generates system-wide value. So some of these things, like we've tried to have two systems where we can link them together. For example, we have the M-Supply. We are working with the DHIS to where we can link the two systems together. They can speak together. We can have LMIS data from M-Supply and the HMIS from the DHIS too. So in a way of that, when you have the two systems speaking, at the end of the day, you have an investment which generates system-wide value. Next, please. Also look at the financing and sustainability. This is very important for any system. You have to look at these critical considerations. We look at long-term financing models, transition from donor dependency. We recently see what happens with the donor fatigue with the USAID and costed national digital health plans, investment in local capacity, and maintenance. This is very important at the end of the day, like our work in Sierra Leone for project Last Mile. We've costed for the digital roadmap with the logistic management information system. For example, for M-Supply, if you want to implement M-Supply in Sierra Leone, we've already costed this implementation so that at the end of the day, we'll have a clear pathway. If you want to come and implement a system like the M-Supply, we have the M-Supply hub where you can go and you can get detailed information about the implementation. So one of the most cited challenges in academic literature is sustainability. This is very important. Digital health system must be financed and maintained and then updated over time. This requires deliberate planning beyond initial donor funding. So this is important. At the end of the day, you have a clear roadmap on financing and sustainability. If you have a system that there is no source of financing or maybe sustainability, at the end of the day, you have a failure at the end of all the implementation. So in all of this, I want you to take a takeaway from this presentation today. Next, let me have the last slide, please. So these are some of the takeaways you have to take from the implementation. So we look at digital health is a system enabler, not a standalone solutions. Africa has made strong progress with uneven maturity. So look at systematic challenges remain structural, governance, interoperability, and financing are essential. In all of this, make sure that you have a foundation that must be strong for solutions that scale. In doing this, you have to make sure that solutions must be at the foundation level, so that when you implement, you have a clear roadmap, and then even in finalizing all the implementation across individual countries, you have continuity on the usage of the system. In conclusion, in understanding the academic and systematic foundation of digital health is essential before discussing specific solutions. This provides the context for the next speaker, who will focus on apply use cases, and then innovations and implementation experience across Africa. Thank you so much.
Well, thank you very much, Patrick, for that very comprehensive and insightful overview. I think we can all agree that your comments on enablers like interoperability have really highlighted the groundwork that we need for the coming future. Before we move on to our next speaker, who will be Ms. Divya Gupta, allow me to simply break the ice. It's something that we usually do to get to know you a little bit better. We usually launch a little poll so that we, can understand a bit more about your background and also help with follow-ups. So hopefully you can see the questions on the screen right now. We'll take about a minute or so to let you answer. And after that, we will proceed with the second speaker. In the meantime, just a gentle reminder that if you have any questions, feel free to write them in the chat, and which we will try to answer as we go. Otherwise, we will also have a dedicated Q&A session at the very end of our session. All right, so far we are starting to receive a couple answers. About 7% of participants have already provided some answers. So the vast majority of the people in this session are public health professionals or program managers. So far, most of you would rate your current experience with digital health as advanced. So congratulations to you. Which challenge do you think digital health interventions can address most effectively in Africa? So here we have a very little consensus, which is always good, I must say. It's always a very multifaceted set of challenges that we're trying to address. But say 50% of you believe that it's health workforce shortages, 50% say it's a weak health information system, 33% believe it's limited access to care in remote areas, and 43% believe it's disease surveillance and emergency response. In the answer to the question, which digital health solution are you most familiar with? Most of you are saying electronic medical records, or EMR. Second place is telemedicine. And then third and fourth place tied, both at 20%, digital disease surveillance systems and AI-based tools. And for the final question, what are you most hoping to gain from today's webinar? Most of you are asking for practical use cases and real-world examples, which is good news because we'll be seeing quite a lot of that. Now, we'll just give maybe 1 more minute or so to let the rest of you answer, and we will proceed with our second speaker. All right, we've now reached about 50% answer rates. So for those of you who responded, thank you very much. We'll now be closing the poll and proceeding with our next speaker. So there we go. We have the results on the board now. Most of you, as mentioned, are public health professionals. Actually, it's no longer the majority who are advanced in digital health. I would say, yeah, 43% of you are intermediate with some practical experience. There is overall consensus on the biggest challenge when it comes to digital health, which is weak health information systems. The main digital health solution that most of you are familiar with is EMR. And what most of you are hoping to gain from today's webinar is practical use cases and real world examples. So I now have the great pleasure to welcome Ms. Divya Gupta, the Chief Business Officer for Global Health at Cure.ai, a well-known and well-respected leader in AI-driven diagnostics. So Ms. Gupta, whenever you're ready, you may have the floor.
Thank you so much, Daniel. And thank you everyone for making time. I'll share in my presentation some examples of what is happening in AI in digital health already in Africa. And these are all real world examples, so please feel free to ask questions in the chat. Can we go to the next slide, please? I'm representing Cure today, which is the world's most adopted healthcare AI solution.
Hi, Divya. Sorry to interrupt you in between, but can you be a bit louder? I mean, the volume is really.
Is it? Okay. I don't know. Is it better now?
Yeah, a bit better, but if you
Okay.
can increase it more.
Let me know if it is not audible. Then I'll shift to my phone, but hopefully you can hear
Yeah.
me.
Yeah, now it's fine. Yeah, thanks.
Okay. I'm representing Cure today. We are present in more than 100 countries globally with presence in more than 5,000 sites impacting more than 40 million lives, across the world. Many of these countries, more than 30 countries, are in sub-Saharan Africa. I saw there are participants here from Nigeria, Ethiopia, West Africa, Kenya, Malawi. We are present in most of these countries with our AI solutions. What I want to start by saying is AI and digital health is not something that will happen in the future. It is already happening and making an impact in your countries today. Can we go to the next slide, please? So I think one thing as you are embarking on the digital health journey, and that is something that we have been focusing on also in the last decade, is that there is a difference between tech and health tech. So it's not in health tech, it is extremely important that the solution is regulatory cleared. Like we mentioned here, the Cure solution is FDA and CE approved. There are clinical publications in respected journals like the Lancet. There are policy decision makers, right, like WHO, which are very crucial to work along with to understand the impact they have on the patient workflow. And I think most importantly, and I'm sure many of the users today will resonate with this, that point solutions don't work. What works is if the AI solution is embedded in the workflow that is being used in the country, right? End to end, what works for the community healthcare worker or the PHC or the screening program, it needs to be embedded in the existing workflow of the country. Can we go to the next slide? Another thing very, very important as you are, making your choices is that technology is one part. It is not the barrier. Technology is moving at a pace which is unprecedented, but making it applicable and making it work in your context, we have seen so many different challenges, right? You have different machines. They are not always from the same brand. They might be 10 years old. They might not always be new. So when you implement a digital health solution, you want that it is integratable with existing infrastructure. You want that the language that is being used in the digital health solution is local to you, right? It is something that your healthcare workforce can understand and interact with. Uh, Electricity and internet both are not always a necessity or a given in many regions across the continent, and that is again something to keep in mind, and we have done that also, is that how do you ensure that the screening program, the tuberculosis screening program for example, does not stop if power supply goes off for a few hours, or it does not stop if the city or the village or the county does not have internet? Can it be completely offline? So these are things that are very important to understand how to take technology into the last mile. And it is doable. So please do think about this and ask these questions as you make your choices. Please go to the next slide. Could you please go to the next slide? I can see that people are not hearing me. Is it still not audible?
The volume is a bit low, Divya. So
Okay.
if you can use some headphones or something like that, I think that would help.
It's very strange because I'm okay. I will speak it even louder, but I, I don't think, I don't know how else to improve it. I can hear some people are saying it is audible. Uh, Another aspect to really make, be considered is whether there is return on investment, right? Every country is facing challenges with respect to investments, especially with the reduced amount of funding, whether it is donor funding or domestic funding. I think it is very important to understand whether the digital health solution will give you the return on investment as you make your choices. I have taken here two examples, one from Nigeria and the other from Kenya. Both these countries, we have done more than 170,000 scans for patients, and there is very good proof that there is a 30% reduction in cost, which is not small, right? It's a 30% reduction in cost while there is a 12% increase in the disease detected. In this case, this is tuberculosis. And this is super important because we do not live in a world where we have endless budgets and funds. So please do ask the question about, will it save budget? Will it save the country money while increasing the impact? Can you please go to the next slide? In the same breath, one of the solutions, and I think this is impactful for many people who are working in the EMR space, is an AI copilot, a chatbot. One thing that I have seen in visiting many countries from Rwanda, Nigeria, Kenya, is that the EMR platforms, while there is strong push for EMR adoption across countries, filling data onto the EMR platform itself is time consuming and it is slowing down the healthcare worker. So typing that data is actually taking away time from the healthcare worker, interacting with the patient. We want that the healthcare workers spend more of their time with the patient rather than typing data on the laptop. And today this is possible, right? Today we know that healthcare workers are spending more than 40% of their time just taking notes, whether it is ledgers, whether it is on a laptop, and that is absolutely not necessary. There are AI co-pilots which can listen to the healthcare worker and the patient conversation. It can be in your local language and they can extract the information from it and fill it onto the platform that your country works with. Whether it is a DHIS2 platform, whether it is a custom built platform, that does not matter. But today, the AI already exists to be able to take conversational data into insights and filling it onto your EMRs. This is something I believe that can be revolutionary, and this will really increase the adoption of EMRs as well as give countries the digital data that they can then use for better decision making. Can you go to the next slide, please? I also wanted to share some examples of the work that we are doing in West Africa specifically. We are present in more than 20 sites across different countries like CAR, Sierra Leone, Benin, Gambia, Liberia, etc. We've screened many thousands of patients, not only for TB. I saw there were some comments in the chat that AI and digital health is a platform decision, and I fully agree. If you are already screening patients for one disease, you can actually do that for broader lung health. So you can screen patients for lung cancer, for cardiovascular diseases, for uh, COPD and TB with the same infrastructure that you invest in digital health and get more return for your country by doing that. So these are some examples from the countries. But I think the last slide is probably my most favorite, if you can move to that. Because technology is one part, and I think the most important part is the users. And these are some examples of the people who are using our system in West Africa every day, and what they have experienced in the last few years has to ensure that the users can really follow the adoption curve and can really learn and start using this technology on a day to day level, because that is when the impact will happen. I hope I was audible, and happy to take any questions now or later. Thank you.
Here, let me introduce myself.
Well, thank you very much, Divya, for these excellent examples. Scale strategies are indeed, as you know, crucial for sustainability. So to wrap our expert insights, we turn to practical next step. Final speaker, Dr. Harpreet Kaur, who's an associate professor at Empower School of Health, brings her PhD in health informatics and frontline experience in workforce development. So Harpreet, please feel free to take the floor. After your intervention, we'll be doing the final poll and the Q&A session.
Thanks a lot, Daniel. And before I move forward, I would actually like to acknowledge and thank the previous speakers, Patrick and Divya. You have both touched upon very important points and set a very good base for me to move forward with today's presentation. So to everyone here, good afternoon, good evening, and thank you for joining us today. So as you all know, the webinar focuses on how digital health and AI solutions can be practically applied to strengthen public health systems across Africa. Next slide, please. So to begin with, these are the basic contents that I would be talking upon today, a basic introduction. And after that, I will take you through the jobs and career pathways in digital health sector. And why I would also like to highlight how these roles are continuously evolving, not just globally, but also across Africa. After that, I will lead you into a discussion on digital health skills that are right now required. And we'll also cover how Empower supports digital health capacity building through its online courses. Next slide. So we all know that digital health is not just about technology. It fundamentally depends upon the people, the skills, and the systems all working together. And this is also highlighted by the World Health Organization that success of a digital health initiative relies heavily on the workforce, which is equipped to design, implement, and sustain these solutions. Even across Africa, there is a growing recognition for the need for a future-ready digital health workforce. Even the African Union has emphasized that workforce development is a critical factor for strengthening public health systems and improving service delivery at a scale. So the session would primarily focus on three core areas, which will be the skills required for digital health roles, the evolving job landscape for digital health, and the significance of partnerships and capacity building. Next slide, please. So we all know that digital health solutions, they are continuing to expand across health system. And this was also highlighted by previous speakers, both Patrick and Divya, they talked about this. And, even though these tools are expanding at an exponential rate, but the main challenge still remains the same if the health workforce has the capacity to implement these tools. So again, it is not about whether a country has an health app or a surveillance system, but if the health workforce has the skills, the confidence, and the leadership capacity to use them effectively. So across all low, middle, high income settings, everywhere alike, health systems are facing a growing digital skills gap. Technologies are often introduced faster than people are trained to use them. So even if you go to a Play Store and you type an app for example, hypertension management, you can see every day new apps are introduced. But how far well are people trained how to use them? So this at large results in underutilized systems, fragmented data, and in many cases, a resistance to change at the point of service delivery. So strengthening digital health workforce talent is not just a technical issue. It is a strategic public health priority for all. Next slide, please. Even across Africa, we see that digital health investments have accelerated significantly, and COVID has further pushed it. So many countries, they have adopted electronic health information systems, disease surveillance platform. They have telemedicine tools and mobile health solutions. But again, the challenge remains the same. The health workers, they are often expected to use these tools without any adequate training or without any technical support. And it is even reported that in many settings, people have to do dual duties, like a nurse or a surveillance officer. They are required to balance their clinical services, the reporting obligations, and then they also have to manage the digital systems, often with limited digital literacy. So this really underscores why digital health workforce development is central to health system resilience. Next slide, please. So parallelly, if you see, then digital health employment is evolving rapidly. And an important message for both mid-career professionals and students is that digital health roles are not just limited to IT specialists or software developers, but digital health competencies are required across a range of both traditional and public health roles. Again, many roles are hybrid in nature. For example, public health professionals, they are expected to work with the routine health information systems, with data dashboards. Clinicians, they are increasingly engaged in telemedicine systems. Again, health administrators, nurses, community health workers, they're all using mobile applications. But again, understanding this changing labor market is essential for students to plan their career, for early or mid-career professionals to look ahead for what can be done in this. Next slide, please. So if you look at this slide, then this very aptly depicts the growing landscape of the global digital health market. So if you see, the growth is exponential in this domain. So if you look at the year 2022, when COVID was at its peak, it was nearly 260 billion US dollars. And presently, if you see, it is nearly double. And it is expected to reach more and more number, as the year or the decade passes. So the demand for digital health labor market is there. Next slide, please. So moving ahead with the same slide, these are examples of some of the career opportunities within the digital health and AI landscape, showing that this field is again not limited to IT specialists alone. So then there are entry-level roles that support routine digital health operations like data management, telehealth services, etc. And these can provide easy access points or entry points for graduates or early career professionals. Now, as you grow in your experience, you can move into mid-level roles that require stronger analytical and system skills, particularly in health data, in clinical systems, and in AI-enabled tools. Then at leadership level, the roles focus more on strategy, on policy, and governance of the digital transformation efforts. But if you see, then parallelly, there is also growing demand for specialty and technical roles, as well as emerging opportunities in areas such as virtual and augmented reality, which again demonstrates the evolving and diverse nature of digital health labor market. Next slide, please. So now the question is that what are employers looking for? So they are, in my experience, and this is what is also documented, employers, they're looking for professionals who can combine the skills, who also have technical awareness along with the health system strengthening. So this includes the ability to work within the public health purview rather than focusing on technology in isolation. So there is a strong demand for professionals who can work confidently with digital tools and health data, and who can communicate effectively across different groups. So it is also important, that mid-career professionals, or they should develop digital health skills, which also opens pathways to greater responsibility, to leadership roles and career progression. For students also, these skills significantly improve employability and relevance, as you have already seen in the previous graph that there is an exponential rise in the global health labor market. Next slide, please. So again, we have discussed this previously as well, but across all regions, one of the most consistent finding is that digital health challenges, they're not just technical, but they are human capacity challenges. And in many health systems, there are already existing digital health tools, but again, the health workers lack a structured or ongoing training in order to understand those effectively. So as a result, again, there is underutilization of the system. So strengthening digital health workforce capacity, therefore, requires focus on several priority skill areas. So foundational digital health literacy is essential, then helping health workers understand what digital health is, how digital tools fit into existing workforce. This will all help to reduce their fear or their resistance to technology. Next slide, please. So now coming to how Empower supports digital health capacity building. So again, Empower's approach has always been, that our learning programs, we always have this clear understanding that our learning should be flexible, it should be accessible, and it should be relevant to real world context. And we also understand, that many of you are balancing your demanding jobs, your family responsibilities, and you have to learn as well. So Empower's programs are intentionally designed to accommodate all these realities. So at Empower, we always take a public health first perspective. And we have positioned digital health not just as an isolated technology, but as a skill which would help you to strengthen health systems in order to understand how to implement these. And the course also includes case studies and reading materials. More importantly, our courses are based on global and LMIC relevance. Next slide, please. So here is a snapshot of our ongoing postgraduate diploma in digital health. This is a one-year course, and the course is in conjunction with UNITA, which is United Nations Institute for Training and Research. And our friend Daniel here is representing UNITA today in this webinar. So in this course, if you look at the module, then it begins with introduction, which is very important for everyone to know that what digital health is, then moving ahead to digital transformations, then two very important modules of innovations of how consumerism and personalized care is, then to emerging technologies or how our technologies advancing in healthcare. Moving on to the broader healthcare revolutions. And importantly, we also address the ethical considerations as well as policy and governance in digital health. And apart from that, we also have a dedicated module on careers in digital health. And as well as on leadership, we also teach our students about health informatics, about the approaches to evaluation. So it is a quite comprehensive curriculum that we have designed here today for our course. Now coming to the slide, that why would you take this course only? So as I have already said, that the course is pretty comprehensive. The curriculum is designed by industry experts and senior academia, and all our modules, they are designed by subject matter experts who specialize in their particular domains. We also have monthly expert sessions and webinars where students can engage with our faculties and they can ask about their doubts. We also have discussion boards. Along with this, we also provide our students with learning resources. They have access to world-class books, to research articles and resources from renowned publishers. And we have an innovative learning approach. The course is flexible, 100% online, and at end of the course, you earn a certificate by both UNITAR and Empower. And you'll also learn about the diverse careers that this field provides. Next slide. So this is the last slide of my presentation, and I would actually like to emphasize here that digital health workforce development cannot be achieved by a single institute or by working in silos. So it requires a collaborative ecosystem which brings together education, policy, industry, all under one purview. So Empower approaches capacity building through a strong partnership model that connects universities, governments, and industry partners. So with universities, we can co-develop the curriculum aligned with their national health priorities. And with the government and industry partners, we work on workforce strengthening aligned with the national health priorities. So I would like to emphasize that these partnerships ultimately ensure that the training which is developed, it remains context specific, it is aligned with what the needs of labor market are, along with supporting the national and regional digital health goals, which ultimately contributes to more sustainable and effective digital health ecosystems. So with this, I would conclude my presentation. So over to you, Daniel, from here. Thanks.
Thank you. Thank you, Dr. Harpreet, as always. Very, very insightful indeed. What a powerful call to action on the talent development. So I believe, dear participants, that we've covered the full spectrum, delivered on what we promised to cover. So starting with the foundations to innovations, and finally concluding with workforce pathways. Now, let's open the floor. We'll select a couple questions from the chat. I'll read those out. As I see them in the chat box. But before we do that, let's open a second poll as I select a couple questions from the chat. That will also help us dearly in following up. So give me 1 second, please, to open the second one.
With our so
All right, so about a quarter of you have already provided some responses. So about 62% of you so far have responded that you're very confident in understanding how digital health can strengthen public health systems in Africa, which is great. About a quarter of you, 26%, have said that you're somewhat confident. So we've got over a 90% threshold of positive responses in that field. In terms of which topic was found most valuable, it's still undecided. There's no clear consensus, but digital health workforce skills and careers seems to be the top so far at 44%, followed by real-world digital health innovations and case studies at 34%. And in third place, we have practical steps for adoption and scale. Most of you are very likely to apply insights from this webinar in your professional or academic work, which is of course very encouraging for us. And most of you, around 72%, have said that it's very clear in terms of how confident you are about the digital health skills needed in the African health workforce. In terms of which next steps you're most interested in exploring, 35% of you are saying that enrolling in digital health training or certification is your next step. So that's great news, considering that Dr. Harpreet has already shared with us a link for a, I must say, fantastic postgraduate diploma in this area. Partnering on digital health projects or research is the second next step, with about a third of you saying that you would wish to do so, followed by learning more about digital health careers. So I'll end the second poll as more than half of you have already replied, and we'll move on to the Q&A session. We've got a question from Wisdom Zdeno Clarkson. I guess the three speakers, any of you can feel free to answer this one. The question reads as follows. A major challenge in Africa today is that many digital health tools generate large volumes of data, but this data is rarely translated into action at the local government or facility level. What practical approaches have you seen work in closing the gap between data collection and actual decision-making within public health systems?
Divya, can you take this up?
Yeah, can you repeat the question once, please? Sorry.
You can also see it in the chat. It was posted at 5:33.
The question reads, a major challenge in Africa today is that many digital health tools generate large volumes of data, but this data is rarely translated into action at the local government or facility level. What practical approaches have you seen work in closing the gap between data collection and actual decision-making within public health systems?
It's a very, very valid and fair point. Very often we hear ministries and ministers themselves say that they don't have enough data to make fact-based decisions. But at the same time, almost half of the time that the healthcare workforce is spending on capturing data. So there is a disconnect. So there are two things I would like to say here. One is that there is still a lot of data getting captured physically in books and ledgers. I've seen this multiple times, and this is because it has to go to the donor or the program implementer, etc. And that data then just lies in those ledgers, right? But second, even data which is there digitally, whether it is data in an EMR, whether it is data that is captured in a digital form, they are not connected often. They are discrete sets of data, and they don't tie into the common platform of the country. So I'll take an example. So for example, if you are running a screening program and you are reporting on, say, malaria or on tuberculosis, you have a platform which is totaling up the total number of patients that you have found, but you are not connecting the data of the screening. So I think while we invest in digitizing data, we also have to invest in integrating this data so that we are not keeping the data in silos, but bringing it up to the dashboards. And it is really what I will say is today with AI, this is so doable. We've done a project with the WHO in the Pacific Islands, not in Africa, but in the Pacific Islands, where we have taken their records, which were paper-based records, and used OCR technology like AI to convert those paper records into digital records. So I think now more than ever, the technology exists to make these integrations, to convert the manual records into digital. I think it needs a bit of vision and political will. So if there are some of you who are missing this, I would say bring it up to the heads of your departments. Make it a priority for the head of the department to get these integrations flowing.
Thank you. Thank you very much indeed. That was an excellent answer. We've got one more from the Bargai Dar. We'll read out her question and then perhaps do one last one after that. So the question reads, how can LMIC health systems technically integrate AI and digital tools while closing the digital skills gap among frontline workers to ensure effective and sustainable system use?
Daniel, who do you want to address this question?
Any of you, as you feel free.
You can take it up, Divya.
The tools exist. So I think there is no question of the tools not existing, right? I think the first question is, what do you want to solve with it? Uh, that is the prioritization. I see so many countries doing hundreds and hundreds of pilots. If we do hundreds of pilots, we are more likely to fail. So I would suggest do 10 pilots, but choose the pilots you want to do. I saw there were questions in the past about who are the funders, who are the donors who are investing in this. Actually, digital health is a priority for all donors, whether it is Global Fund, Gates Foundation, Rockefeller, even the World Bank, Asian Development Bank, Africa Development Bank. Everybody's focus is on digital health. So I have not come across any funder whose priority does not include digital health in some shape or form. So if you define your problem and then look for funders who are interested in this space, not the other way around. So first look for the problem you want to solve and then look for the funders. The tools exist. So I would strongly suggest not recreating new tools, because then you are spending money on effort on problems which are already solved. So look for the best tools, and it is very, very possible.
So I completely agree with Divya here. Because instead of replicating the solutions which are already there, it is better to implement and adapt it to your particular region or setting. And the other question, which was regarding the digital skill gap among frontline workers. So the only way you can do it is by capacity building, by training them, by educating them about digital health, how the tools are. And we actually have courses for that. Empower already has a postgraduate diploma in digital health for that. And you guys can go and look into our courses, and our sales and operations teams are here. They will help you understand about it better. So thanks.
Oh, indeed. Thank you. Thank you, all of you. This has indeed been quite a rich discussion, and I'm sure that if you have any more questions, you can always reach out to us. You have our email addresses and other ways of reaching out to you. I think the Empower team has also shared the necessary links. We very much hope to welcome you in our online courses, which have been really quite, for lack of a better word, empowering for the hundreds, if not thousands of students that we've already trained over the years. So key takeaways for today: digital health thrives on strong foundations, innovative AI tools, and skilled workforces. And probably the main takeaway is that Empower School of Health and Unitar are here for you, ready to partner, and we are very much looking forward to welcoming you. So thank you also to Patrick, Divya, and Harpreet for your expertise. Your comments have been as insightful as always. We hope to see you at the next webinar, of course. And quick reminder, for more on Empower School of Health's digital health programs, please visit the website, the link for which you should be able to see in the chat now. You can find the recording of the session on Empower's YouTube account, and we hope to see you next week on the 29th of January for our webinar on, titled rather, From Molecules to Markets, the Global Pharmaceutical Industry and Careers in Pharmaceutical Management. So thank you to all, and stay healthy.
Thank you, Daniel. Just one thing I would like to inform all our participants here, that our team has already added the link to generate certificate for participation. So you guys can go and click on that link. And in case if you have any queries, our team is there to help you up with that. So thank you, Divya, Patrick, and Daniel. It was really good listening to you all. And thank you, Daniel, for moderating.
See you next time.
Thank you, everyone.